Hi, we will continue with our lectures according to the syllabus in the IST University. And this is the third lecture about evaluation of fixed prosthodontics and restorative, indirect restorative dentistry. Part of it is taken from the book of Stephen Rosenstiel, Contemporary Fixed Prosthodontics, chapter 29 and page 751. We will first try to explain why is this topic essential? Because of course, well-fitting, tight-fitting crown with good margins, good contact points, and good occlusal surfaces relationships will guarantee the long-term success of this restoration. Also, will guarantee the long-term health of the gingival tissues. Now, what are the points of this try-in or evaluation stages? First, we should check the internal fit and the seating of the restoration, then the margins of the restoration, if they fit closely to the preparation margins, the interproximal contacts, of course, the occlusion, and the aesthetics and final approval of the patient is important. So we will dive deeper into these different categories of try-in, first starting with the seating and the internal fit. How can we tell that this crown won't fit? Of course, there's a small noddle here in this area, and this noddle resulted from maybe bad or not properly executed casting and finishing procedures of the metal. This will lead, of course, to the rocking motion of the restoration of the prepared tooth structure, and finally, it won't sit in its place. So we should diagnose properly what are the reasons for these misfitting restorations. Some causes are related to the impression taking or lab inaccuracies, sometimes for tight contact points, but this is rarely. And of course, the internal binding of the restoration also is very important. And this is why I need a little bit to remind you that when fabricating casted restorations, metal casted restorations, we use the lost wax technique. And this implies the use of wax and subsequently the melting of the wax and the casting procedures. This is manually done. Today we have another type of fabrication procedure of the metal restorations, which is 3D printing. And with 3D printing, the machine is automatically creating the metal without investing, without casting. It's done with lasers, with the use of lasers, laser melting, and subsequently the fit of these restorations that are produced with the additive method, the 3D additive method, will be better than the traditional, lost wax technique. And this is why most of our laboratory technicians right now in Damascus City, they are not using the old technology, but they are sending the casts to a few, places where they own these expensive machines. Other than metals, we can use also zirconia crowns, and these zirconia crowns are produced by CAD-CAM milling or subtracting method. What I want to say is that we have different types of dental restorations, and each one has its properties according to the manufacturing stages that will be introduced in. In other words, when we make the manual fitting of the restorations and the manual manufacturing, we have discrepancies that are added on, and these are different from the CAD/CAM manufactured zirconia crowns. In CAD/CAM manufactured zirconia crowns, the process is automated and it might be a little bit more precise, but of course with experienced hands. Uh, So how can I check that the internal fit of the restoration is excellent? By using either this material, which is fit checker from GC, or the, well, let's say elastomeric impression materials, but the light body material, droplet or small piece of base and catalyst are mixed, then they are introduced inside the crown, and the crown is fit over the prepared to structure with a little bit of rocking motion. After that, we'll remove it after setting the impression material. And as we can see here, we have places of binding. We call them binding places. We should remove them, and subsequently they should be ground, and with fine diamonds, of course. And this process is checked repeatedly. And we should check also the thickness of the restoration. So when we are fitting the restoration, if the thickness is not so appropriate, less than 0.3 millimeters, it might be perforated, or we might perforate the inner surface of the restoration during this stage. So be careful if we have and check if we have the appropriate thickness or not, because this plays a very important role uh, in the fit of the restoration. So the internal fit of the restoration should result in a tight, well fit, well binding restoration. And in these areas where it's cut on the margins, we should see the cookie cut at the margins. What this guarantees is that the restoration after cementation would withstand the forces of dislodgement first, and also the micro leakage. When there is a small gap between the inner surface and the outer surface of the elastomeric impression material during the fitting stage, this means that there will be in the future a sort of a leakage of the cement, and this will of course jeopardize the long-term longevity. So we will dive deeper into these different categories of the restoration. Margin evaluation, we should check the margins if they are well fitting or not, if there are gaps, for example, overhangs. What does it mean overhang? Overhang is a sort of place at the margin where this margin is overextended outside the preparation area. The opposite is the ledge, where as you place the explorer from the margin of the restoration to the tooth, a sort of a, balcony, let's say, or sort of a part of the tooth which is uncovered by the restoration is also present. This is also not appropriate. And the third one is the presenting of gap. Gap presentation is also not appropriate. So the best margins are those who fit exactly on their place, and during the movement of the explorer from the unprepared tooth structure to the margin of the restoration, there should be no gap at all, and they should be, or they should feel very smooth. So if there are deficiencies in the fabrication of the restoration, most of the times it should be repeated, but sometimes we can a little bit, for example, amend the margins of the metal, especially using rubber caps, for example. The zirconia margins are very precise, but they are also hard to adjust. Zirconia is very hard, and this is why it's a little bit complicated to polish and finish the margins of zirconia crowns. All ceramic restorations, lithium disilicate or even feldspathic, they should be handled very gently because chipping might occur, and we might need to refabricate the crown again. So this is important. So we will dive deeper into these different categories of about margins. Now, I will talk a little bit of about proximal contacts. We should check the proximal contacts using dental floss or other materials such as, for example, articulating paper. Sometimes they are useful. You will place the articulating paper, then place the crown and pull a little bit the articulating paper and in the contact point. After removal of the restoration, you can see the binding area on the proximal surface. Of course, a small degree of tightness is important because it will prevent food entrapment, but also loose contacts means that they should be redone because they might lead to food impaction in the contact area. So how we will check the contact areas, the place, the location, the size of the contact point, the tightness, all of these are important. And we will check them using either dental floss, as I have said previously, or with the Miller strip. The patient's feeling also is important. Sometimes they might tell you that there's a pressure between the restoration and the adjacent teeth, so you should check carefully. But of course, if everything goes smoothly between you and the laboratory technician regarding the preparation, the impression taking, the fabrication of the restoration, the contact point is rarely an issue in fixed prosthodontics. So we should prepare these contact points carefully and amend them carefully using fine diamonds. Then we will polish and finish these contact points. So we will dive deeper into these different categories of. So as you have seen, the occlusal adjustment and the occlusal equilibration is the last stage in the trying process. First, we should check the binding and the fit of the restoration. Then we should check the margins of the restoration, contact points, and finally the occlusion. There is no point of checking the occlusion before we are sure that the restoration sits completely in its place. So how can we check the occlusion? Of course, with articulating paper. And these articulating papers have different thicknesses. And these different thicknesses are important in the, well, precision of this process. So why do we use two-colored or two-sided articulating paper? Of course, when checking the occlusion, we have the static or the vertical occlusion, and we have also the excursive movements. So with the first color, we will mark the supporting areas on the supporting cusp or the functional cusps. And then when we turn the articulating paper on the other side, we will have the opportunity to mark the excursive movements over the restorations. So in general, we need to have canine guided occlusion. And if the teeth touch on the posterior parts of the teeth during excursive movements, these contact areas should be removed, and subsequently we need a different color to mark these areas. And it's better to use, of course, thin articulating paper. 80 microns is not good for clinical dentistry. Of course, it's used by the dental technicians. In the clinical settings, we prefer to use 40 microns and even less, even thinner, 12 microns, or what is called sometimes shimstock. Shimstock is a very thin foil of an articulating paper that doesn't have color even, and we only use it to fill the tug or the how it's held by the teeth. Now, in posterior regions, sometimes when restoring second molars, there's not enough space to place a crown. What can we do about it? It's recommended, and the Rosenstiel in his book has recommended that we can a little bit grind from the opposing teeth, especially from the cusp tips of the opposing teeth, in order to, well, make sure that there's enough space for the restorative material in the restoration or in the part of the tooth where we need badly this space. In other words, this should be done during the preparation stage, but not after that. If it's done after that, during the trying stage, the patient might feel a little bit that something awkward is happening, and he might ask you that, why are you grinding from the opposing tooth? But if you communicate properly with the patient and explain to him that we are obliged to, well, remove a little bit of tooth structure from the opposing teeth in order not to damage the tooth and to provide the tooth with a little bit more retention, I think the patient will accept this thing. So better during the preparation stage, but should be explained to the patient, grinding of the opposing teeth. Occlusion on different materials is, well, can be differently corrected. All ceramic restorations are brittle, so we should be careful to use fine diamond burrs. Zirconia is very strong, and yes, it's allowed to grind a little bit from the occlusal surface of the tooth. And of course, this won't damage the zirconia. On contrary, the zirconia can be damaged when we are grinding from the inner surface of it. Why? Because it changes its stages from monoclinic to from tetragonal to monoclinic and vice versa, and internal cracks might propagate inside these areas where the zirconia has been grinded from the inner surface. But when it's grinded from the outer surface, there's no problem at all. Metal ceramic restorations, they also can be corrected, but as it has been said previously, if all the stages of the fabrication of the crowns are well executed, there won't be a great need to prepare from the occlusal surface of the restoration during the try-in stage. Now, sometimes the fit of the crown over the articulation or of the articulator is not so appropriate, and this is why the laboratory technician asks us to take a small bite registration of wax over the metal try-in or over the zirconia crown during the try-in stage. What he will do subsequently, he will place the byte registration, and on this byte registration he will push the die until it touches the inner surface of the byte registration, and after that he will compensate for the lack of space, and this byte registration from the wax will help him to know exactly how much should be compensated during this stage. Of course, this is not the ideal scenario for building the occlusal surfaces of the restorations, but sometimes it's needed to take only a small, well, let's say localized bite registration over the metal try-in during the metal try-in stage in order to the laboratory technician to know exactly what is the space that is present after try-in the metal in order to, well, fabricate the porcelain over the metal substructure. So we will dive deeper into these different categories of aesthetics. It's a huge topic, and we'll discuss not more than 3 or 4 ideas because they are related to the trying stage. Anyway, we should check the shape of the restoration, the contour, the outer emergence profile, the midline, and the incisal edges during the trying stages. Of course, the patient's feeling and feedback also is important. We should communicate properly because aesthetics is, as has been said, it's the management of expectations. So this is why also we should uh, talk regularly to the patient and ask him what does he feel that will be the best choice for him according to aesthetics. So translucency and surface texture, it's well related to the age of the patient. Young patients might have more texture over their teeth, while older patients will have smoother surfaces. Of course, there are a few, well, let's say terms that should be a little bit, we should be familiar with them. The transparency and the translucency of the restoration. Of course, the transparency is that the light will penetrate inside the tooth or the crown without any refraction. Translucency means that part of the light will be transmitted. Opalescence is the shape of the incisal edge and the place where the translucent area and transparent area will meet the body of the tooth. Polychromatism means that the tooth has different colors. Perichromata are these shapes inside the tooth, and the line angles also are very important. These line angles will determine the face of the tooth, so sometimes if we bring them together, the tooth might look a little bit narrower, and when we separate the line angles toward the interproximal surfaces, the face of the tooth will look a little bit broader or wider. Anyway, these are related to the laboratory technician, and we don't have any big role in deciding how much these structures can be manipulated in order to satisfy the patient. But of course, choosing the appropriate material and choosing the appropriate laboratory technician will spare us too much time. I need to explain a little bit about zirconia and the types of zirconia. The strongest type of zirconia is the one that is stabilized with 3 millimoles yttrium, and it's called 3YZ or yttrium stabilized zirconia. It's very strong, and we make the coping of the restorations, the infrastructure of the restorations and the bridges out of this zirconia. The strength, the compressive strength, the flexural strength is around 1100 megapascal, so it's very strong. And this is why it shouldn't be used also as a final restorative material in monolithic zirconia. In monolithic zirconias nowadays, we have the cubic types of zirconia, which are a little bit transparent. Of course, the flexural strength of these cubic zirconia is less than the tetragonal or the very strong zirconia crowns. They are stabilized with 5 yttrium millimole, but yes, they are more aesthetic. And we have also the sort of the medium brand between the very strong 3 millimole and 5, which is the 4 millimole yttrium stabilized zirconia. It's strong enough to withstand occlusal surfaces, and the strength is also proportionate with the aesthetics in these types. So depending on these differences in the materials, we will choose the appropriate material for the place where it is used, and subsequently during the trying stage we should take into consideration what type of zirconia we are dealing with. If it's a very strong material, core build-up material, or the core, where the core is the essential part of the zirconia and the very strong material, we should take care that it should be grinded with very rough diamond burrs. Subsequently, or alternatively, the 5 millimole yttrium stabilized zirconia are more aesthetic, but they are prone to chipping. As I have said, texture is important, and the texture is increased in younger ages. Sometimes we have the challenge to mimic the natural teeth, especially when we are replacing a central incisor, and this is why we have the modality of using these special tints inside the ceramics in order to match the adjacent teeth. Be careful that ceramics shouldn't be introduced inside the ovens too many times, since the firing cycles might create internal porosities, which is called devitrification, and it's better to achieve the best results with the least amount or the least numbers of firing cycles. In all ceramic try-in, sometimes we used to a little bit, reshape the outer surface of the ceramic and the zirconia, and we can use, of course, these rubber wheels, but they are color-coded with this yellow part that indicates this rubber wheel is intended to be used on ceramics. So the yellow part of the rubber wheel indicates that this is not intended to be used on the tooth structure, and it's intended to be used on ceramics. During the trying stage also, the color of the ceramic might influence, for example, the porcelain laminate veneers. So this is why we have try-in pastes, in order to check what will be the influence of the resin cement over the final aesthetic result. And these are, of course, water-soluble pastes. We should decide first with them, then we will pick the right color of the resin cement, and sometimes also the color of the bonding agent sometimes might be a little bit of concern if the restoration is very thin, if the porcelain laminate veneer is very thin, we might pick or choose a bonding agent that is a little bit transparent and not yellowish. And as we have seen in this video, All Bond from Bisco is a little bit transparent, while the 3M products are more yellowish, and be careful that they might influence the final color of the veneer. Zirconia try-in, it should need minimal. So we will dive deeper into these different categories of adjustments, and a little bit of remarks over the bridge try-in. The try-in stages of the bridges are a little bit problematic, since we have the pontics and the retainers. So we should check the contact points, but we should also check the pontic, the lower part of the pontic, where it meets the ridges, and the retainers, especially the periphery of the retainers, since they might represent a weak point in the stability. Now let's watch this movie together, which is the try-in stage of a metal ceramic bridge. As you can see, the first stage is to remove the temporary bridge, and to remove also the remnants of the temporary cement, since it might prevent the complete seating of the bridge over the abutments. Then I've tried the rocking motion of the bridge on the cast and on the working cast, checking the thickness of the metal also is very important. At this stage, 0.5 millimeters, minimal 0.3 millimeters is important. Less than that, the metal might perforate, or also it might deform during the firing stages, subsequent firing stages of the ceramic. After that, during the placement or during the checking of the rotting motion, we should check that everything is okay and that we have also the appropriate thickness where the porcelain will be placed over this metal substructure. Now that the patient came and we are trying to see and to check if the internal surface of the restoration will fit properly over the abutment teeth, we'll take a little bit of base and catalyst from the global elastomeric pressure material. We'll mix them thoroughly and we will place them inside the inner surface of the restoration in order to check the fit of the restoration and to reveal where are the binding points, we call them the burning points inside the metal, where the metal will fit prematurely inside the abutment teeth and will prevent the complete seating of the restoration of the prepared teeth. So we need to discover and to reveal these areas. Sometimes if you are checking the fit of our casted post, we might use this spray, which is dye spray, especially intended to make a sort of color over the casted post, and then we can introduce also this post inside the canal to check these or to reveal these early checking areas. Now in this part of the video we see that we have discovered a few areas of early binding. We will mark them with a pencil, and after removing the elastomeric impression material, we will be sure that this elastomeric impression material is completely removed from the inner surface, and we will memorize where are these points exactly. Of course, with the help of the pencil, they are already marked, and we will grind on these areas which represent an early until we are sure that the metal fits exactly over the abutment teeth. So how can we see this has been done properly? The final check will result in an elastomeric impression material with minimal film thickness. All the surfaces inside this area are very thin, and of course the margins of this area will be very well adapted to the full structure. This can be checked with an explorer, and finally we will evaluate the occlusal space where the porcelain will be fired over this metal substructure. At this stage also it's important to recheck the color and the shade, and of course we might need also to take a small, we call it localized bite, box bite, over only the metal structure in order for the laboratory technician to check that this thickness of the space is appropriate to place the ceramic over it. I'm from the dentists who prefer to remove the temporary cement using the ultrasonic device, and then after cleaning the inner surface of the temporary bridge, we will re-cement it again using laser catalyst. In this video I'm using Probicol, which is a calcium hydroxide temporary crown and bridge material, and I'm placing the bridge, the temporary bridge, to serve for a period of 2 or 3 days until the laboratory technician has successfully built the outer surface of the bridge with ceramics. Today, in order not to place too much cement inside the temporary bridge, I use these small pellets or these small applicators in order to just paint the inner surface of the temporary bridge with the temporary cement.
عضي يا أختي عضي افتحي وسكري عدة مرات كمان افتحي بالله
spot the areas and it can mark the areas of the ceramic that are not glazed easier than when it's glazed. So
سكري
checking first
وحرك
the
يمين يسار،
centric occlusal stops,
يمين
then
يسار،
observing the
أيوة،
frontal
للجنب الثاني،
area with the
أيوة، كمان وسعي الحركة أكثر،
other sort of
يمين يسار،
color, for
ممتاز،
example,
كمان
the red one
كمان
on supporting areas, the
كمان،
blue
أيوة،
one for
افتحي بالله.
excursive movements. And right now I need to see that all the contact points are present that support the occlusion. And only on the canine there is this guidance. Of course, I will check at this stage the
طفي عليه،
contact points using dental floss and
شغلتي عبير.
rechecking the color and the shade of the restoration within a wet surface. Of course, it's
طفي.
very important to have a little bit of wet surface over the ceramic to check the color. At a subsequent stage, the restoration will be glazed and further cemented. Of course, we should check the connector, the thickness of the connector, especially if you are fabricating these minimal preparation bridges made out of zirconia, especially when they are cantilever design. It's better to have a thickness of 12 millimeters between the connector or between the pontic and the retainer. إذا بدك قيمة تغليف تمام ممتاز من برا ومن جوا، من جوا كمان زي ما قلت لك. ولازم نرجع بعدين بقى الخضراء. نقدر نرجع الخضراء. اوكي بس هلا الخضراء بقى من جوا. شلون كنت عملت من شوي؟ ايه بس تفتلها من جوا وتزومها على الطابات. رائعة. هي ميرسي كثير. At the last stage, and before the cementation of the bridge or the restoration, we should also obtain the approval of the patient. Not only the color and the shade, the function also is important, the phonetics is also very important because we don't have any other choice after cementation. We don't have the opportunity to change anything from what has been said before. Sometimes, unfortunately, if the patient is unsatisfied after the cementation, sometimes we need to cut the restoration and to make it again, and this will be a huge sacrifice of time and money, and also the relationship with the patient might be ruined. We should also warn the patient that he should come to the clinic regularly, or not warn him, but at least remind him that regular checkups are important and that he should also clean the restoration regularly at home using not only toothbrushes, but also these types of flosses, special flosses, for example, the super floss or the special brushes, the interproximal brush. Water flossers are also important. Uh, Whenever he has the time to clean the restoration, this will be better for the long-term service of the restoration or the bridge in his mouth. With this slide, we have finished this presentation. I hope you have enjoyed it. It was about the training stages. It's an undergraduate lecture, but I think it will be helpful to withstand the exams and the national exams also for undergraduate dentistry. Have fun and take care until next lecture. Bye bye. So we will dive deeper into these different categories of